Hello, good afternoon. So I'll be giving the rationale for question of the day for March 4th of 2022. So please listen. Right. So first thing that I should do is to highlight the question. So let me grab my highlighter here. Okay. So most important details first. So I strongly believe that the most important details here are the following. Complaints of acute and severe colicky pain. This is important because when you say colicky, it should already give you an idea of what structure is involved, right? When you encounter that colicky pain. Then, colicky pain in the lower quadrant, abdominal area, which has a radiating pain to the tip of the urethra. Okay, so that's important information. In addition to that, the patient reports urinary urgency, frequency, and hematuria. So which of the following is the most likely cause of the patient's symptoms? If we're going to go back to it, we have acute and severe colicky pain, patient with hyperparathyroidism, urinary urgency, frequency, and hematuria. The information that were presented is actually would give you that it is a renal calculi or a renal stones, right? Renal stone is common to patient with primary hyperparathyroidism. So that's a big check right there. The incidence of stone formation is 4 times greater than in women. So technically we have here, so let me just do some here. Okay. So if you're going to notice, it's a male and hyperparathyroidism. So this is actually an information that would help you to confirm that it is renal stones or renal calculi. Primary hyperthyroidism four times greater than in women. So there, the male patient. And the manifestations include severe and colicky pain with hematuria. So this hematuria here, all right. The pain is so severe that the most people are unable to find a comfortable position. Urinary urgency, frequency, and dysuria are often present. So the details establish the fact that it's a renal calculi. And even if you're having a problem establishing that it's a renal stone, you don't have a choice because all of the options that we do have mention calculi. Okay? Take note of that. So the question is asking for the location of the stone. So this requires anatomy and physiology and pathophysiology, right? So the location of the pain is the best way to identify the site. And in this case, the location is in the lower abdominal area. There you go. Lower abdominal area. And of course, this radiating pain to the tip of the urethra. Okay. So if you go back to your referral pain patterns, if you go back to your Goodman differential diagnosis, it's very specific there on the referral of pain. Okay, so I want you to go back to that particular lecture of referral of pain. Hold on. All right, I do apologize for that. My laptop has problem with battery. But anyway, okay. So if we're going to go back to this, if we go back to our referral pain, we can do now elimination. All right. So the first thing that I would eliminate here, the one thing that would really just pop up in my mind if I'm going to answer this is number three. No, I'll eliminate this immediately. And let me explain why. Okay. Kidney. So kidney is actually located on the posterior part of our body, and it is actually near on our T10, T11 to T12 ribs, right? So technically it's lower thoracic and upper lumbar area. If you go back to your anatomy, right? To the point that there is a costovertebral angle. That's where you can find costo means ribs, right? Vertebral, then the vertebrae. So that's the angle that is created there. That's where you can find your kidney. So if you're going to imagine it, stone lodged at the kidneys, or we call it your nephro, right? We call it your nephrolithiasis. Okay, we call it your nephrolithiasis. It presents pain at the thoracolumbar junction. And again, why is it thoracolumbar? Because your kidneys are actually found in the lower thoracic area and upper lumbar area. To be very specific, we call it your costovertebral angle, right there. And when you tap that, it would cause, and when you palpate it, it would cause pain. And there's a particular name of that, right? So please figure that out. Then it could also be felt in your middle lumbar and upper abdominal, and of course, it would the patient would report tenderness at the costovertebral angle. So if we say costo, that means your ribs. Vertebral, so technically the junction of your ribs and the vertebrae at the posterior part of your body, not the back. So therefore, we can eliminate number three. So this is already eliminated. Another thing that I would eliminate here is your urethra. That's urethra. Urethra is already very near to your penis and to your vagina, right? So urethral calculi will present with acute urinary retention and distal penile pain and pressure. So it would already give you some pain on your penis and some on the vaginal, on the women's urethral junction. Okay, so therefore I should be eliminating this because the pain is in the lower quadrant abdominal area and with irradiating to the tip of the urethra, tip of the urethra. So therefore, I'll eliminate number four. So it's either urinary bladder or your ureterovesical junction. Okay. Number two should be eliminated. Why? Because bladder stones do not have specific symptoms, or it is even asymptomatic. Because remember, the bladder is big in nature, so it would not really cause some pressure, right? Pain may be present the sacral apex and suprapubic area. But if you're going to really imagine it, it would not cause some problems with the endothelial area, or I'm sorry, with the tissue of the urethra, because urethra is big in nature. So therefore, the best answer is number one. The location of the pain is the lower abdominal quadrant that radiates to the tip of the urethra, and this is a manifestation of the ureterovesical junction. So if you're going to imagine it, let me try to draw this. Okay. So if this is your urethra, I mean ureter rather, and then this is your urethra. So it's somewhere here in this area. Okay, the junction between the ureter and the vesicular, not vesical. Let's say vesical automatic, that's your bladder, right? So therefore, the best answer is number one. Okay. So I hope that you've learned something. I hope you were writing down, and God bless. See you on the next question.